Hello everyone, I am Dr. Anil Kamath. I am a senior surgical oncologist at Apollo Hospital, Bengaluru. So let me talk to you all about an important topic on rectal cancer. This is about sphincter preservation. Now, one of the biggest fears of patients with rectal cancer is that they'll need a diversion of the stools. They'll have to live the rest of their life wearing a bag on their stomach through which the stools come out. So great is the fear that many patients refuse treatment for this reason alone. Now, while this fear to some extent is true, to a great extent, the stool diversion, especially permanent, is not required now in majority of the patients. And this can be done without compromising on the oncological safety of these patients. There have been two major developments in rectal cancer in the last 2 decades or so, which has helped us to do sphincter preservation in more and more patients. The first of this is what we call total neoadjuvant therapy, and the second is the use of robotic surgery. So let me elaborate about each of this. What is total neoadjuvant therapy? Earlier, patients with rectal cancer used to undergo surgery directly. Now, more and more, especially if it's a cancer of the lower third, we are not operating them directly. We are assessing the tumor by way of a PET scan and MRI. And if the tumor is a little larger, or if the nodes are positive, that is, if it is T3 or N1 stage, then rather than operating, we are giving them chemotherapy and radiation. The radiation is started initially. There is a certain dose which is to be reached in a specific number of days. And after that, we give full doses of chemotherapy. The plan being to complete as many cycles as possible before surgery. So why do we do this? The main reason we do this type of approach is to shrink the tumor to the maximum possible extent before we operate it. By shrinking the tumor, a tumor which is close to the anal sphincters might move away from it, making a sphincter preservation surgery possible. In certain cases, we get complete response with no residual disease, and nowadays there is some thought that these patients can be just observed without going for surgery. So this is about total neoadjuvant therapy. The second important advancement has been the use of robotic surgery. Now, robotic surgery comes with a lot of advantages, especially when we are treating with the tumor of the lower third of the rectum. The vision is enhanced. You see quite a magnified view. So the sphincters which are responsible for sexual function can be preserved. The ergonomics is much better. We can reach much lower planes without compromising on the safety. In fact, we can go as low and see the sphincters and do what is known as a intersphincteric resection. In many ways, robotic surgery is even better than laparoscopic surgery for cancers of the lower third of the rectum. And because of the use of robotic surgery, we are able to do resections which are very low, which are very close to the sphincters, and then we are able to bring the colon down and anastomose it to the end of the rectum. So these are the two major developments which have happened in the last few decades, and I feel any patient with the cancer of the rectum, especially if it is of the lower third, should make use of these benefits. Thank you.